The volume and concentration of urine are regulated by hormones. The amount of water reabsorption affects urine volume and osmotic concentration. There is obligatory water reabsorption. This occurs in locations where water movements cannot be prevented, such as the PCT and descending limb. The rate cannot be adjusted. It recovers 85% of the filtrate. Facultative water reabsorption occurs in the DCT and collecting tubule. This allows more precise control of water reabsorption. It adjusts urine volume by reabsorbing a portion or all of the remaining 15% of the filtrate volume. No water is reabsorbed in the DCT and collecting tubule. No facultative water reabsorption. Urine volume with ADH. ADH allows water channels to form. Aquaporins appear in the apical plasma membranes of the DCT and collecting tubule cells. Water permeability of the last tubular segments increases, and water reabsorption increases. Normal urine is about 1,200 milliliters a day, or 1.2 liters. The values differ from person to person and from day to day. Our kidneys alter their function to maintain homeostasis, and you can see the characteristics of normal urine, the normal ranges. pH is 4.5 to 8, average of 6, and other characteristics. Renal function is an integrative process involving filtration, reabsorption, and secretion. This is renal function overview. The renal corpuscle has the same composition as plasma except for plasma proteins. The proximal convoluted tubule, ions and organic nutrients removed from tubular fluid. Water follows by osmosis, and this reduces the tubular fluid volume but keeps tubular fluid and peritubular fluid isotonic. The PCT and descending limb of the nephron loop is where obligatory water reabsorption concentrates the tubular fluid. The ascending limb of the nephron loop actively transports sodium and chloride ions out of the tubule and lowers the osmotic concentration of tubular fluid. The DCT and collecting system make adjustments: reabsorption of secretion of solutes and hormonally controlled water reabsorption. The vasa recta absorbs solutes and water from the tubules into the systemic circuit and maintains the concentration gradient of the medulla. Which part of the nephron responds to ADH stimulation? The distal convoluted tubule. Which of the following organs is found only in males? The prostate gland. Facultative reabsorption of water due to ADH occurs in which of the following structures? Collecting duct. Renal failure is when the kidneys cannot perform their excretory functions needed to maintain homeostasis. It impairs all systems in the body, resulting in reduced urine production, disturbed fluid balance, pH, muscular contraction, metabolism, and digestive function, hypertension, anemia from decline in erythropoietin production, and central nervous system problems such as sleeplessness, seizures, delirium, and coma. Chronic renal failure is when the kidney function deteriorates gradually, and these problems will accumulate over time. This progression can be slowed, but the condition is not reversible. The management involves restricted water, salt, and protein intake. This reduces strain on the urinary system by minimizing the amount of urine that's produced and the amount of nitrogenous waste generated. Acidosis is a common problem with renal failure and can be countered by ingesting bicarbonate ions. In acute renal failure, kidney function deteriorates rapidly in just a few days. It may be impaired for weeks. Sudden slowing or stopping of filtration may be caused by exposure to toxic drugs, renal ischemia, urinary obstruction or trauma, allergic response to antibiotics or anesthetics in sensitized individuals. Recovery or partial or complete function is possible if patients survive the initial incident. The survival rate is approximately 50% with supportive treatment. Dialysis is a process of passive diffusion across a selectively permeable membrane. Hemodialysis uses an artificial membrane as an alternative to the kidney's normal membrane around the glomerulus. It regulates the composition of blood during using a dialysis machine. Membrane pores allow diffusion of ions, nutrients, and organic waste, but not plasma proteins. Dialysis fluid containing specific concentrations of solutes is run on the other side of the membrane. Shunts or silicone rubber tubes connect the blood vessels with the dialysis machine. Dialysis relieves renal failure symptoms, but is not a cure. Kidney transplant is the only real cure for severe renal failure. Patient survival is more than 90% at 2 years after the transplant. Close relative donor increases success rate, and immunosuppressive drugs are necessary to reduce the rejection of the transplant. The urinary tract transports, stores, and eliminates urine. The filtrate modification and urine production end when the fluid enters the renal pelvis. The tract includes the ureters, urinary bladder, and urethra, and can be visualized using a pyelogram. X-ray image of the urinary tract taken after a radiopaque dye is administered intravenously. The ureters are paired muscular tubes extending from the kidney to the urinary bladder. They're about 30 centimeters long. They are retroperitoneal. The urinary bladder is a hollow muscular organ holding up to a liter of urine, and the urethra extends from the neck of the urinary bladder to the exterior of the body. The male urethra is longer and transports semen as well as urine. The urinary bladder is filled by the ureters and drained by the urethra. The dimensions vary with how much it's full, how much is filling it. The posterior, inferior, anterior surfaces are outside the peritoneal cavity. It's anchored to the pelvic and pubic bones by supporting ligaments. Inside are rugae that disappear when it fills, just like the stomach. The ureteral openings have a slit-like shape that helps prevent backflow of urine into the ureters with bladder contraction. Ureters penetrate the posterior bladder wall at an oblique angle. The trigone is a triangular area bounded by the ureteral openings and the entrance to the urethra. It acts as a funnel, channeling urine into the urethra with bladder contractions. The neck of the urinary bladder surrounds the urethral opening and contains the muscular internal urethral sphincter. This is involuntary. The external urethral sphincter is located where the urethra passes through the urogenital diaphragm. It's under voluntary control. The walls of the urinary bladder contain mucosa, submucosa, and muscularis layers. The muscularis layer has 3 layers: an inner longitudinal layer, circular layer, and outer longitudinal layer. Collectively, the layers form the detrusor muscle. Contraction compresses the urinary bladder and expels contents into the urethra. Urine is transported from the kidneys by the stored in the and eliminated from the body through the urine is transported from the kidneys by the ureters, stored in the bladder, and eliminated from the body through the urethra. Urination is called micturition. It's a reflex that coordinates the process involving a local reflex pathway and a central pathway through the cerebral cortex. With the local pathway, the stretch receptors of the urinary bladder wall distort as it fills. The urge to urinate appears when the bladder contains about 200 mL of urine. Afferent impulses are carried to the sacrospinal cord. Parasympathetic motor responses stimulate the detrusor muscle to compress the bladder. In the central pathway, the interneuron relays the sensation of bladder fullness to the thalamus. Projection fibers relay the information to the cerebral cortex. Voluntary relaxation of the external urethral sphincter causes relaxation of the internal sphincter. Since pressure is already increased, relaxing the sphincters leads to urination.